we will be implementing an order requiring masking indoors, regardless of vaccination, that will go into effect at 11:59 on Saturday, July 17th. Wearing a mask when indoors with others reduces the risk of both getting and transmitting the virus.
Good evening, everyone. Those over the age of 12 who are able to get vaccinated, if you're vaccinated, you shouldn't wear a mask.
You mentioned there had not been a decision to change the guidelines on wearing a face mask for fully vaccinated Americans, but have there been any conversations within the administration about possibly changing those guidelines?
Well, we are guided by the science, and we're guided by our public health experts, and any decision would come from the CDC. The head of the CDC spoke to this earlier this morning.
So conversations within the administration, that's what the Washington Post was also reporting. There were early conversations in the administration about possibly changing those guidelines.
I've seen the reporting, but what I can tell you is that there has been no decision to change our mask guidelines. If any decisions about public health would be driven by the CDC.
We heard the CDC director today warn about the rise in the Delta variant, saying that it's spreading with incredible efficiency. At what point would the White House reconsider the protocols for the president and for administration officials?
Well, we're guided by the public health guidance and the CDC guidelines, and that's what we abide by here. They have not changed those, and so we continue to abide by the guidelines we've announced to all of you.
If you guys are now reportedly considering asking vaccinated people to wear masks again.
Well, first of all, the CDC director, who oversees decisions along those lines and all of our public health decisions, made clear that that was not a decision that had been made just a few hours ago. So I point out that first.
But the president said in May, vaxxed or masked. I think a lot of people got the vaccine because they were hearing him say, if you get the vaccine, you don't have to wear masks anymore.
And that continues to be CDC guidance.
Is there a conversation about encouraging people to make the personal choice that Dr. Walensky talked about today if they, for example, are vaccinated but live in a state with low vaccination rates or have other considerations? Is part of your messaging going to be encouraging the personal choice piece on mask wearing?
Well, that is currently our messaging, right? So I would say that for communities where there are lower rates of vaccination, and as we know, that's really concentrated in only a handful of states across the country where most of the cases are coming from, as we've seen the rise in the Delta variant, which is more transmissible, and if you're not vaccinated, it is transferring, no question, more quickly across people. People should wear masks, and that is something we will continue to encourage leaders and civic leaders and educators and people who are trusted voices in communities to make clear.
And those are vaccinated people you're referring to make the personal choice to wear the mask in those high-rate areas.
That's not the advice of the CDC at this point in time, so that is not a message we are conveying to people.
Dr. Walensky said today that it can be a personal choice for the vaccinated.
Of course, it can be. And some people make that decision because they are immunocompromised, because they have family members, because they just want an extra layer of protection, and we should all respect that. But it is not proactive guidance that the CDC is providing.
Dr. Fauci told reporters earlier today that there isn't enough research to know whether breakthrough cases can result in long COVID. The president has repeatedly told the public that they're safe from the worst effects of COVID. How can he be sure without this research? And if there's even a chance that breakthrough cases can result in long COVID, why not recommend masks more widely?
Well, I think what the president's referring to, one, we've seen some interesting polling over the last week. I believe it was a CBS poll that showed that vaccinated people in the country are more fearful about the Delta variant than unvaccinated people. That's clearly concerning to us because unvaccinated people should be more fearful. What the president wanted to convey to people in the country is the impact and effect of getting vaccinated. So we also know statistically that 97% of hospitalizations are for people who are unvaccinated. And that the vast majority of cases are asymptomatic or have very mild symptoms, which the health and medical experts will tell you. That's true. There's still research about a range of components of the impacts of COVID over the long term, which our health and medical leaders will advise us on. They also have not changed their guidance on masks. That is not a determination that's being made from a political standpoint or from anyone in the White House. That is something the CDC and our health and medical experts are advising on, and they look at a range of factors.
Can you confirm that White House officials are involved in these discussions about whether or not they need to update the mask guidance?
Well, first, the CDC director made clear that was not a decision made. We are regularly in touch and have regular meetings with our public health officials, including the CDC, about how to continue to address the virus. That shouldn't surprise anyone. Those conversations cover a range of topics. But I think the most important thing for the public is that there hasn't been a decision made. It will always be led with public health guidance, and they've made that very clear this morning.
It's just unusual that no one will confirm the discussions are actually happening.
Well, I think because the report on it was a little breathless about what it implied was happening when the CDC director said that's not a decision that's been made, and we want to be clear to the public, nobody is being advised who's vaccinated to wear a mask. That is not what the public health guidelines says.
And is the White House concerned about the messaging aspect of this, given not having to wear a mask is often a perk of being vaccinated that the White House and other top health officials have touted? So are you concerned that if there is a change to the mask guidance for vaccinated individuals when they're indoors, that it would be harder to sell vaccinations, essentially?
Well, there hasn't been a change, and it's pretty clear now that if you're vaccinated, you don't need to wear a mask. If you're not vaccinated, I don't know, that's a hard word, you should wear a mask according to the public health guidelines. That's not a prediction that the CDC director made this morning.
This is a question for Dr. Walensky. I've been talking to epidemiologists, and one of their concerns is that the CDC's masking policy lacked teeth, so most people just took it to mean they didn't need to wear a mask at all. San Francisco is now contemplating requiring proof of vaccination to get into bars and restaurants. Other people have suggested that masking regulations change if cases go above 5 per 100,000. Are there any thoughts in the works of either clarifying or changing CDC's masking policy?
Thank you, Elizabeth. As we have said consistently, the greatest risk right now is to those who are unvaccinated. And we have consistently and repeatedly said, if you are unvaccinated, you need to be wearing a mask to protect yourself and others around you. And we need more people to get vaccinated to stop this pandemic. So overall, the CDC recommendations haven't changed. Fully vaccinated people are protected from severe illness. And we've always said that communities and individuals need to make the decisions that are right for them based on what's going on in their local areas. So if you're in an area that has a high case rate and low rates of vaccination where Delta cases are rising, you should certainly be wearing a mask if you are unvaccinated. If you are vaccinated, you get exceptional protection from the vaccines, but you have the opportunity to make the personal choice to add extra layers of protection if you so choose.
There was this report overnight about the White House discussing masks, discussing mask mandates in light of LA County's decision and the rise of the Delta variant. Can you tell us whether that report is correct? Is the White House, in fact, having high-level discussions about that?
So on masking, I think you just heard a very strong summary from Dr. Walensky, and that's where we are. We will follow the science, and public health guidance is made by Dr. Walensky and her team at the CDC. So we will continue to follow the science and follow CDC on mask guidance or mask recommendations.
Thanks so much. Dr. Walensky, I just want to circle back on this just so we have complete clarity. Is the CDC considering right now changing its mask guidance for people who are fully vaccinated?
We are always looking at the data as the data come in. Our guidance has been clear since we put it out several months ago, and that is if you are unvaccinated, you should continue to wear a mask and protect yourself against others around you. And more importantly, you should go and get vaccinated to get better layers of protection. We have always said that local communities have to look at what is going on locally as we have very heterogeneous country right now. In areas that have a high amount of disease and low amounts of vaccination, that, you know, if you're unvaccinated, you should absolutely be wearing a mask. If you're vaccinated, you have exceptional levels of protection from that vaccine, and you may choose to add an extra layer of protection by putting on your mask, and that's a very individual choice. That has been consistent with our CDC guidance since we put it out.